Hi guys, it's Morgan. So today I'm going to be talking to you about spaying and neutering because I seem to get a lot of questions about it and there's been a little bit of debate in the comments. So I just wanted to kind of put in some information about it. I know a lot of people don't really know what it is, or maybe they don't fully understand it, or they just want some more information about it. So that's what I'm going to be talking about in this video. I really just wanted to get a video out there because I haven't made one in forever and you guys have been asking for a video, so I thought this would be a good one to start with. So before I begin, I know you see some action going on over here. It's not Sadie. This is actually my new puppy. Her name is Rosie. She's a Chihuahua and maybe Dachshund, we're thinking. But yeah, she's very sweet and playful and we just love her. So she's really tired. So if you see anything rumbling around in the background or if I get distracted, it's her. I'm going to go ahead and get started on this video, and I'm going to be reading off my computer a little bit because I had to do some research to make sure that I got down most of the information that I wanted to talk about. So, spaying or neutering is the procedure in which your rabbit's reproductive organs are removed. Female rabbits are spayed, meaning that the ovaries and uterus are surgically removed, and males are neutered, which means that the testicles are clipped and removed. So there's usually some confusion about the words. They pretty much mean the same thing. It's just spayed is for females and neutered is for males. Some other words that you might hear associated with it are fixed and altered. That just means it could mean spaying or neutering for both genders. So that's basically what it is. It's just sterilization of the rabbits. It removes their reproductive organs and keeps them from being able to have babies. That's the primary function of the surgery. If you don't know kind of about the reproductive organs, the testicles are the sacs that hang below the rectum on the male, and they contain sperm, which allows the male to fertilize the female's eggs during reproduction. And the ovaries are located in the very lower abdomen on the inside of the female rabbit. The uterus is just below it, and that's where the litters of baby rabbits are held. Spays are more invasive procedures than neuters are because the reproductive organs of the females are located on the inside rather than on the outside. The males have an easier and shorter recovery time. Females have to be cut open. It's not as bad as it sounds, but they have to be cut open and their ovaries and uteruses are removed and then they are sewed back. So they do have a more lengthy recovery time. So that's pretty much the gist of what the procedure is. So like I said, the prime function of the procedure is to deem the subject sterile, meaning that the rabbit is physically unable to reproduce. Any sexual hormones that cause certain behaviors will be removed with the organ. That could include, for the males, spraying urine, which is a very common behavior that people, you'll go up to the cage one day and you'll see urine all over the wall next to the cage and you're like, really? That's a hormonal behavior that males tend to do when they first enter sexual maturity. So that's one issue. Another one is humping or mounting, which can occur in either gender. Aggression, the procedure can reduce the smell of urine. It can make it less pungent, not smell as acidic. It also reduces the risk of testicular and uterine cancers or other illnesses involving reproductive organs. So this basically can extend your rabbit's lifespan depending on what could happen. Studies show about 85% of female rabbits will develop a deadly uterine cancer by the age of 4, which could kill them within the year, so that could cut their lifespan in half. So this procedure could be a really good preventative as well. Even if you aren't planning to get another rabbit, you don't want to breed or anything like that, it's a good preventative procedure to do because it can reduce the risk of your rabbit getting any sorts of reproductive cancer or other diseases or swelling or anything like that. It really depends on several factors. You don't have to have your rabbit fixed. I don't want anyone to think that as soon as you get your rabbit, you should run and go get it fixed. You don't necessarily have to. It is recommended, but it's not something that you have to do. So here are some factors that you might want to consider. If you ever plan on getting a friend for your rabbit, if you ever want to bond your rabbit to another rabbit, if you ever plan for it to be in contact with any other rabbit at any time, then it is highly recommended. If you don't alter your rabbit before giving it a friend, it could prevent your rabbit from bonding. Those of you who don't know what bonding is, the bonding process is when two rabbits are introduced slowly over a period of time and essentially develop an inseparable friendship which allows them to live together. Bonding it's a process that can take a while, but it's very good for your rabbit to have someone to live with that it understands, another rabbit. So if you plan on ever exposing your rabbit to another rabbit, same or opposite sex, then you should get your rabbit fixed. If you get a rabbit of the same gender, you should still have both rabbits fixed to reduce aggression and dominance behaviors. This especially happens with males. They tend to get very aggressive and dominant oriented together, even if they're from the same litter. People always ask me, what if I get two bucks from the same litter when they're babies and raise them together? It doesn't matter. Once they hit that age of about 3 to 4 months, when they start getting those sexual hormones set in, they are going to start experiencing these aggressive hormonal behaviors. And it doesn't matter if they're related, it doesn't matter if they were raised from babies together. Typically, once they hit that age, that's when they're going to start fighting. So it is best to, even if you decide to get two bucks that are babies and start from when they're little, raise them up. Once they hit that age where they start to fight, you separate them, you get them both fixed, keep them living together for a few weeks until they're recovered and those hormones dissipate, and then you can start to properly bond them over the course of, a few weeks is usually how long the bonding process will take, and you should do it the right way to keep them from becoming aggressive towards each other. The best bonded pairs are opposite sex pairs, meaning that they're male and female. Having both rabbits fixed and then slowly bonding will present you with the strongest bonded pair outcome. Two females tend to work as well. They do, of course, experience aggression because it's just a dominance thing having the same gender together. It's a more competitive environment. With a male and female bonded pair, you tend to have less issues with aggression. You will still see some humping and mounting in the beginning, which is just a dominance thing that's going to happen with any gender, but you tend to have the least issues bonding a male and female pair that are both spayed and neutered and have both been properly introduced and healed from their surgeries and their hormones have been dissipated. Once that happens, that's when you tend to get the best bonding results. Another question that you might want to ask yourself is your rabbit aggressive? If it is, that could be a sign you might want to get your rabbit fixed. At about 4 months, like I said, that's when the hormones start to set in, and that's when your rabbit might start to show some aggressive signs. Aggression issues are simple expansions of hormonal imbalances, which could be reduced by the altering procedure. That doesn't necessarily mean that if your rabbit is aggressive, it will completely stop being aggressive and turn into a completely different rabbit after the procedure, but it's possible, and it definitely does help with the hormonal aggression. If your rabbit has a health condition that prevents a veterinarian from okaying the surgery, which could be a heart problem, anything that would combat with the anesthesia, things like that. Another reason is maybe if you plan on not getting another rabbit in the future, ever. That's one situation when you may not need to get your rabbit fixed. Also, if it doesn't display any negative hormonal behaviors like spraying, aggression, or mounting after the age of about 4 months. The prime recommended age to have your rabbit fixed is between 6 months and a year. There's a lot of debate about this age. There's been fights in the comments below my videos asking about it. Typically, the safest, youngest age to start is 6 months. Sexual hormones set in at about 4 months, as I've said a few times. Sorry about my phone going off. Once that has set in, you need to give it a couple of months for your rabbit's reproductive organs to completely develop, for all those hormones to set in. You can really see those behaviors grow some prominence, and once that's happened at about 6 months of age, that's when you can take your rabbit in for the procedure. That's the earliest age that I work at a vet clinic. That's the earliest age that we personally recommend. Some vets will do it earlier, but the safest, in my opinion, is 6 months. So if you fix your rabbit later than about a year of age, many of the hormonal issues will have become habits, and therefore they won't be reduced very much by the procedure. It starts as hormones and then it turns into habit. So your rabbit will experience these hormones, start to maybe be aggressive, and you think, okay, well maybe it'll pass after about a year when they get older. Typically that doesn't happen. This aggressive behavior will just continue and will turn into a habit. So if you decide to get your rabbit fixed at about 2 or 3 years old, that's okay, and it is safe to do physically, but it won't reduce those aggression issues. So if you want to keep your rabbits from developing negative hormone-inflicted habits, it's best to get them fixed between 6 months and a year. It is extremely routine. It's a very normal procedure. Many veterinarians do it on dogs and cats, but it's important to make sure that you get it done by a rabbit-savvy vet, a vet that knows what they're doing when it comes to rabbits, because rabbits are different than dogs and cats, and they can process anesthesia differently than dogs and cats do, and sometimes you could put a rabbit under and it just doesn't wake up. Sometimes they do have that problem where they just didn't properly process the anesthesia, and they tend to have issues more so than dogs and cats, but that it really shouldn't be high on your radar. It is a very routine procedure. Any surgery has a risk factor, and it's very important to take your pet into a clinic with that mindset. So just know, when you're taking your animal, any animal, in for surgery, there is a risk factor. And also a good way to tell if your vet is rabbit savvy is if they offer you a pain medication. You will want a pain medication following the procedure because they are going to be in some pain, and rabbits don't handle pain very well. So if your veterinarian does not offer you a pain medication, that's how you might know to be a little bit wary. For Willie's procedure, they gave him a liquid oral medication, and I just gave it to him out of a syringe. It didn't taste bad. He just ate it, or he took it, you just put it in the side of their mouth and they will swallow it. And it was very simple, and he was on that medication for about 4 days. I'm going to move on to the second part of this video. I know this video is probably going to be a little bit long, so if you got all of your basic questions answered in the first part, then you can go ahead and exit out of this video unless you want to hear about what to expect during the procedure. So scheduling the procedure, like I said, make sure that your rabbit is at least 6 months old. If the procedure is done when your rabbit is too young, it could result in a messy recovery and health problems later in life. This is really important. Try to schedule it on a day when you can pick him up the same day as the procedure. Your rabbit spending the night in an unfamiliar place can be extremely stressful, so make sure that you can pick up your rabbit the same day. Do not fast your rabbit. Dogs and cats, the vet will tell you to fast them so they won't vomit. Following the procedure, rabbits cannot vomit. They don't have enough muscle in their stomachs and esophagus to allow them to vomit, and they have a continuous GI tract, so they always need to have their GI moving. If your veterinarian tells you to fast your rabbit, do not let them do the procedure. They don't know what they're talking about. If your rabbit stops processing food for any length of time over 24 hours, your rabbit could die. So that's a very serious thing. It can cause GI stasis, and it's definitely not something that you want to do. So do not fast your rabbit. He should be eating directly before and directly after the procedure. Letting your rabbit eat before surgery keeps their GI tracts moving, which will speed recovery up. Rabbits who don't eat well after surgery can slow down recovery, and it can prevent them from going back to their normal diet routine. So it is very important to keep them fed. It should go with its carrier, something familiar from home like a blanket or a towel, something that it lays on, its favorite fleece blanket, something that's familiar. You should also bring them a water bottle, or with a water bowl, make sure that they're keeping hydrated before and after the surgery. You should also bring normal food and hay for your rabbit. So after the surgery, pain management is very important. Your vet will offer an option to purchase pain medicine. You should always take this medication if it's offered to you. If not, you should demand it because it's very important to speed up recovery. My pain medication for Willie costed no more than $20, and it really will help your rabbit to stay comfortable during the recovery. If your rabbit is uncomfortable, he won't want to eat, and that could cause some serious problems. So when you bring your rabbit home, it's very important to monitor him. If your rabbit has a 2-story or 2-level cage, make sure that you block passage from one level to the next. You need to reduce movement in any way. No jumping, no playing. He needs to stay calm and stay immobile for the most part. This will help him to keep away from that incision. Some rabbits lick their incisions. It's very important to watch the incision and make sure that it's staying from getting too swollen or oozing any kind of liquid or getting bloody, bumpy, rashes, anything like that is what you want to watch out for. So if you do see anything like that, you'll want to tell your vet about it. During the recovery, you want to keep your rabbit warm. Some people get heating pads, or you can just keep a lot of blankets, keep the room warm, but you want your rabbit to stay warm. Not hot, but warm during recovery. It will speed up the recovery and help keep your rabbit comfortable. As soon as you get the rabbit home, you want to make sure that it's eating and drinking normally. You need to place everything right near him so he doesn't have to move much to get to his food. If he's very tired, he won't feel like going across the cage to go and get his food, so I would move everything to a central location where he doesn't have to move very much to get to his food or water. Check the incisions twice a day. Check it in the morning and before bed. Make sure that it's not swollen red or creating discharge, like I said. So anything like that. If you see anything that's strange, call the clinic and ask about the situation, describe what the incision looks like, and the vet will usually do a follow-up about 10 days after the surgery, I believe. So if you see anything alarming, you should always call your veterinarian and just ask about it because it's better safe than sorry. You want to handle your rabbit as little as possible. If you try to pick him up and he struggles, he could rip his stitches, so it's very important not to handle him very much, except when you're checking the incision, which it's very simple. If your rabbit is laying down, you will just want to carefully put your hands around his back and shoulder blades up by his neck and put your thumbs underneath his paws and gently lift him up so you can see his bottom and then put him back down. That's the easiest way to check the incision. If he starts to struggle, leave him alone. You don't want to rip those stitches. Don't hover, don't stress him out, don't do anything too out of the ordinary. Don't sit there and stare at him. He's going to get stressed out. He's going to be like, okay, why are you staring at me? What's going on? He's going to get stressed out. So don't hover, just check on him and make sure that he's doing okay and eating okay. That's the important part. A little bit of oozing is normal, but actual blood coming from the incision is something that should be alarming. Redness, swelling, or pus are signs of infection, and you should call your vet if you see signs of any of those things. If everything goes properly as far as recovery, your rabbit should be getting up and moving around the day after surgery, but they should still be sluggish even on the second day from the anesthesia wearing off. Males typically recover from a neuter in about 3 days, but their hormones don't completely disperse for 2 months. So during this time, don't keep your male rabbit with an unspayed female rabbit because she could still get pregnant. Females typically recover in 4 to 5 days because spays are more invasive. I think that I covered everything. That was a super long video, but I do think that I got most of the points that I wanted to talk about. So if you guys have any questions, please put them in the comments below. And again, I don't have a camera, so the only thing I have right now is the webcam, so I'm trying my best. I tried to record some videos on my cell phone. I have an iPhone 6, but I don't have very much storage on my phone, so I can't record very much video at one time, and it can get pretty frustrating. So I'm probably going to do some informational videos like this until I can get a nice camera secured, and I know it's taken forever. This has just been a crazy year. Again, thank you guys so much for watching. If you have any video suggestions, you can leave them down below. If you have any questions about spaying or neutering, then you can also leave those below. And my next video will probably be about bonding because people tend to have a lot of questions about that too. Again, thanks for watching, you guys, and I'll see you in my next video.